Hello.
Hello.
Just turning on my video.
Just
Right.
a quick hi, Tony. Just to let you know, I'm James from Maverick, so I'll be sitting and listening on the call. So anything you need, polling, etc., I will be listening. But for now, I will mute my microphone.
Okay. So welcome everyone to our person-centered complex care theme meeting. I can see that we've got about 38 people in the meeting so far, and I guess there may be some others join us. Hope we're all getting familiar with the with the portal. Okay, I am now going to try and share my screen. Okay, I'm kind of hoping you can see my screen.
We can.
You can. Excellent. Okay. This doesn't quite look like how I was expecting it to look. Okay, right. So I'm going to
just, Tony, if I could, so just everyone that's watching, I know we're just about 50 people, so that's nearly everyone for the theme into the discussion, a few more to join. If you're using the chat, if you are watching in outside of Zoom, please use the chat on the right-hand side. That's also where the polling will appear per the intro video. But yeah, I'll hand back to Tony.
Yeah, so I'm just trying to work out how I can see my...
Sorry, Tony, what was the question?
Sorry. I can't see the screen, so just wondering everyone else. Can everyone see it?
I can see the slides, yeah.
Tony, try to press F5 if that's what you want to do, share the big screen.
Yeah, to put it in presentation mode.
Yeah, I will do in a second. I'm just trying to work out how I see my slides as well as see the app, and I'm not sure that I can.
It might not. Can you do? I don't know.
I've had to disconnect my other screen because it was interfering and it was taking away sound. Anyway, let's try and make a start. I might have to flick between my sharing screen and the app so that I can see what is going on. So if I flick now to the, I'm now looking at the app. Can you still see my PowerPoint presentation, or can you now see the?
We can see your PowerPoint presentation, Tony. It looks good.
Fine. Okay, so I can toggle between that and the app by the looks of it, so I can look at the chat. Okay, thanks. Sorry about that slight technical hitch. So again, welcome to our person-centered complex care theme meeting. We need to get on with it because we're on the meeting will end as dictated by the timing. So I'm Tony Marson, theme lead, and with us also with access to the microphone are Jenny Downing, our fellow, who most of you will know. But do you want to say hello, Jenny?
Hi, everybody. Hope you're enjoying this morning. We hope to make it entertaining.
And a big welcome to Pallavi Deshpande, who's joined us very recently as our theme manager, and it's been a great addition to the team. Do you want to say a couple of words about yourself, Pallavi?
Hello everyone, my name is Dr. Pallavi Deshpande. Tony said, the theme manager. So if you have any questions for the PCC team, or if you have any that you'd like to put in through the PCC team, please feel free to contact me. I'll be putting in my email address in the chat in a few minutes. I hope you enjoy the day.
Okay. No, I'm not so there was some sound issues there. I'm not sure whether that was my internet connection or yours, Pallavi, but do please let me know if I'm starting to sound a little bit scrambled. I think the presentations that you heard earlier were great and give a bit of a feel of the sorts of things that people are doing connected to the theme, as well as the sorts of areas of endeavour that we can take take forward. There were two things that we wanted to highlight to you. One is that there's been a national multi-morbidity call. So there is funding for cross-ARC projects, and the team in the Midlands are leading on multi-morbidity, and there's an opportunity for each ARC to put forward 2 bids to be considered, as well as for our ARC to work with other ARCs on projects led by other ARCs. And we'll keep you posted about that. The process is evolving, and the projects that are going to go forward are going to be selected over the next few months. The other thing to highlight is that we're pulling together a multi-morbidity scoping survey. We're aware that there is quite a lot of multi-morbidity work going on our patch, and it's not pulled together very well, which makes it difficult to know who's doing what and to pull together that critical mass. So we'll be putting out a survey soon, and Lauren Walker, who's got a particular interest in multi-morbidity and polypharmacy, will be providing some clinical leadership to that. Okay, so many of you will be aware that over the past 8 to 12 months, we've been on a journey to try and work out what are the priorities of the partners, and of course COVID has created some challenges, but also made us focus on some things that we might not necessarily have focused on before COVID. And one of the things that we want to do in this workshop or in this meeting is to sense check some of the things that have come out of that. And the 3 priority areas that have been identified in the workshop so far have been around digital healthcare, and you've heard a bit about that already, continuity of care, and multi-morbidity and polypharmacy. So we had planned to have a mixture of some word clouds and some voting, just to get kind of in a digital way an opportunity for you to provide some feedback and views. So we're going to start off with a word cloud, and if it works, great. If this turns out to be technically beyond us, then we'll need to regroup and maybe just use the chat. So in the first session, James highlighted that on your screen you've got this panel on the right, and I've got a very unsubtle red arrow here pointing to the bit of that panel that you need to have access to for the word cloud. So you'll need to click on that speech bubble so that you've got access to the right bit for the word cloud. Hopefully that's
totally perfect.
Yep.
Thanks for the illustration. I'm gonna just had a chat with Pallavi before. I'm going to post the question for Word Cloud 1 in the chat, and we're going to ask people to comment. So not create a new post, click the comment button and put the word that you associate with the specific question, and then we will be able to go through them rather than doing it this way as you're sharing your screen throughout, if that makes sense.
Sorry, I didn't follow that. Tell me again.
So I'll post the Word Cloud 1 question in the chat on the right hand side, as you just pointed out, rather than doing it through the link that we discussed earlier.
Okay, and will we still have a live word cloud, or are we looking at developing the word cloud after the meeting?
We won't get the build one, we'll get it after the meeting, but everyone will still be able to see everyone's words.
Okay, right, so we're going for plan B. Okay, right. So the first area that we'd like to get you to think about is around digital healthcare, and a big focus of that has been on video consultations and how they are best used, but there are other elements of digital healthcare. So what we'd planned to do was to create some live word clouds, but it sounds like that might just be a bit too technically difficult. So we'd like 2 sets of words or brief sentences, if you're willing. The first is on to give you your positive views and experiences of digital healthcare. So I wonder if we can give that a go. So wanting you to put something in the chat, words in the chat that describe your experiences or what your expectations are that are going to be positive around digital healthcare. So do we just put words in the chat, James?
Yes, please, yes. And if anyone is on Zoom, you can use the main platform. You should see a message from me just coming through. I see people are using the chat now. So
yeah. So if everyone could use the chat on the right-hand side of the platform rather than the Zoom chat.
if anyone is using the Zoom chat, we are still following it. We can see it. It's just it's not going to be recorded, but that's fine. If anyone is joined by a Zoom, some people are on their phones and things like that. So.
Yeah. So we've got. I've taken the liberty of putting in no travel and green, and we've got here we have already got that no travel. Yeah.
Yeah, we've got easy access, flexibility.
Easy and effective. Got cheaper. Efficient. Yeah, I can see quite a lot of comments are coming in the Zoom chat as well as in the app chat. Excuse me. Okay, so James, if we're going to have a separate question next, we'll need to, I guess if they're positive and negative things, it'll be fairly obvious what's positive and what's negative.
Yeah, I think so. I'm happy to. I think we're covered. So we've got someone covering both chats. So maybe we go through the platform comments and then read out the Zoom ones, because I think some people are on their phone or have joined externally. So.
Yeah. So. Yeah, there actually. Okay, so there are quite a lot of actually most people are using Zoom chat rather than the app chat, aren't they? Yeah, convenience, easily accessible, safe consulting, easy access, flexible, cheaper, safer. So lots. Okay, so could I get you to switch your mind and now be rather negative and think about what are the downsides of digital consultations? Yeah. Okay. Right. Yes. So yeah, so we've got difficulty impersonal, difficulty building relationships, isolating. Yeah, shifting work
relationships.
Yeah. So lots of things popping up there.
Digital divide. Yeah.
Yeah. People feeling shortchanged. Yeah, not as reassuring as a person. Yeah.
Excluding, we've got for some people.
Yeah.
Difficult for hands-on problems.
Yeah. So that's okay. So that's yeah. A lot. Okay. So lots of stuff flooding in. So that's okay. That's great. So I'm conscious of time, which is whizzing by. So we're gonna carry on. Okay. Right. So in our in our workshops, we identified a number of areas that we might want to address in terms of digital healthcare, such as what are the longer term impacts of remote consultations and the provision of different models, what are the impacts of the number of health inequalities, and certainly I think as some of the comments earlier worry that we might be widening rather than diminishing health inequalities. What's the cost effectiveness of a digital first approach? So can we triage effectively and make and use digital consultations efficiently? Do we really have any models co-produced with the public? And what about vulnerable populations? They were the things that have popped up in our in our workshops. So we thought we'd try and get you to vote to try and sense check the what's come out of the consultations. So we had planned to do 2 votes, and again we'll see how that goes. So in the first instance, we want you to vote for your first choice of the options that come up. So on your chat on panel on the right, the voting option is actually the far right button. So the unsubtle arrow is pointing you at that. Okay.
Yeah, just to add to it, quite a lot of people have joined through Zoom, which is fine. Where you click the join via Zoom button, if you go back to your web browser where your schedule is, you'll find the link that Tony asked. You can leave Zoom open. You'll find both polls where Tony pointed out there.
Yeah. So I guess So most of the comments earlier came in through the Zoom chat. So again, let's see how the voting goes. Hopefully, you'll all find access to that panel, and I guess drop a note in the chat if you're really struggling to find the voting panel. So one of the things that we can do working with the Midas theme is undertake some systematic literature reviews to help underpin the work. So we've identified some questions to help us decide on the areas that we want to drill into. So one of your first, we should hopefully a straightforward voting question is, if we're going to focus on some systematic reviews and subsequently research, what setting might we want to focus on? Would we want to focus on primary care, secondary care, community care, urgent and emergency care, or should we actually say we want to understand the evidence in all of the above? So I'm just going to toggle to the voting, and so I can vote. So I'm going to vote and see what happens.
Should see the live results, Tony. I'm just going to add each question just before you introduce it, so they should start to appear in succession.
All right. So James, what? So okay. So the first vote that's come up is about the primary gap in knowledge. So we should address that question first. So the questions are what the longer term impacts of consultations and healthcare provision on different models of care. The second question is about inequalities. The third about cost effectiveness, and so on. Hopefully you've been able to get at those. I'm going to vote. Okay, so this is clearly proving quite a challenge because we've only got 3 people that have been able to vote as far as I can see. Am I misreading that, James?
I don't think it tells you how many. Let me just, I can give you the results one moment. Are you looking at 1A?
Right. Okay. I'm misunderstanding. I thought that the 3 is the number of people voting, but it may be something else.
That's the number of polls, sorry. So the polls are ordered from, if you scroll to the bottom, that will be so Q1. So the first poll is at the bottom. If you like, the latest poll is at the top.
Yeah.
It'll show a percentage.
Okay. So the people are most interested in the longer term impacts, and as well as the impact on health inequalities. Can we move to the next poll, James?
Yes, so everyone should be seeing the polls that have been published so far. Question 1A, there's 36 responses on that one. 1B, question 2, which is the one your slide deck's on now, is also published. It's about 40 responses on that, and I've just published question 3, which I know you've not moved on to yet, but just so people have got access to that as well.
All right, so I'm failing here, James. So I can only see the first question, and I can't see how to get to the other question.
If it helps, Tony, do you want me to run through the results? So just tell me the question number, and I can read through the results for you, so you can see what people have voted for.
Yeah. So do you want to? Okay. So what?
Question 2.
So do you want to take us through the results for question 2? I'm struggling to get at it at the moment.
Of course, not a problem. So question 2, we've had 42 responses. 43.8% of people are saying primary. Oh, it's moved again. 44% on primary care, 3% secondary care, 6% for community care, 6% for urgent and emergency care, and 43% of people saying all of the above.
Okay. Just wrestling with Zoom here. Okay, so let's. I'm going to toggle back to the presentation. So, yeah, I'm really not sure why I can't see that.
It's fine if it helps, Tony. If you introduce the questions, question 3 is up now, and then if you just cue me, and I'll go through the results if that helps.
Yeah, cool. So yeah, I think the problem is trying to toggle between two programs here. So so the next question was about should we drill down on any ologies? So should we actually just go with multimorbidity, or should we focus on a specific disease area, or should we actually have a different focus, which is the something else question? So has that question been polled, James?
Yep, that's on there.
Question 3 has been polled, yeah.
Yep. So and
57% vote for multimorbidity.
Yeah. Okay. All right. So the questions are, yeah, I can see them now. 57% voting for multimorbidity.
Going up. Yeah.
Yeah. Cool. Yeah. So multimorbidity and mental health, and then I guess mental health, that multimorbidity of physical and mental health is where we were expecting. Okay. Cool. So I can see the next question has now popped up in poll. So the next question was should we drill down onto a specific population, such as young people, those unable to consent, deprived groups, digitally excluded, older populations, or potentially all of the above? So yeah, do you want to give us your view about that? Yeah, so deprived groups, digitally excluded, are winning that, and all of the above. Okay, so yeah, okay, so I think the general view is that we should take a broad approach. Okay, I'm going to move us on because I'm aware that time is whistling by. And if we're going to measure something, what sort of things do we think are important to assess in terms of how digital consultations are performing, which is question 5. Yeah, so quality of care and however we measure that is kind of winning that vote. Okay. Jenny, shall I hand over to you? Do you want to talk about continuity of care and tell me where to move the slides on?
Yes, happily. Are we going to continue with our word clouds? I'm just quite aware of the time that we've got left. Do we want to still carry on with the word clouds, or do we want to leave them for another day? Or ask people to come back and do them.
Sure. Yeah, perhaps we could we could do those offline after the meeting. So I'm aware that we've got about 9 minutes left, if my timekeeping is.
Yeah, time has ticked on quite quickly, unfortunately. Yeah. So I think what we need to do is we need to just move to our priority area number 2, which is continuity of care, which was highlighted from all of our workshops that we did. And one of the gaps in, I'll just go through the gaps in knowledge and understanding that were highlighted from our workshops. Basically, what is continuity of care? How do we measure it from different perspectives? You know, for some people, continuity of care is about the relationship continuity that they have with their GP or their specialist consultant. For others, it's more about the seamless care that they get, about the management continuity, which they can get from a care coordinator, or ensuring that the conditions are managed through integrated healthcare records or through care plans. Then what are the important patient outcomes to measure? You know, are we really talking here about patient satisfaction, or are we talking about measuring something more like quality of life or use of healthcare services when we talk about patient outcomes that we should be focusing on? Also, what is the impact of integrated models of care, and what are the effective components of successful models? We know that the vanguards were very important, and since the pilot ended, you know, we've moved to integrated care systems, or STPs, and there's some evidence of the success around these, and they're typically around integrated care systems or models of care that focus around particular conditions, less evidence around population level systems, and less information available on the components that are effective on those. So is that something that you feel we should be focusing or prioritizing? And also, is advice and guidance between primary and secondary care having an impact on polypharmacy, patient care, or use of secondary care? When we talk about advice and guidance here, what we're talking about really is those systems that are in place to improve communication between primary and secondary care, so that clinicians can have those conversations about the patients to make sure that they're referred to the right place at the right time, and not referred in various different, you know, more times than they ought to be. But there's little evidence around that. So if you could vote on the right or wherever on your device to say which one of these do you think is the most important for us to focus on as we move forward? Okay.
Yeah, so there's
I'm voting now.
Yeah, so there's a majority looking at what are the important outcomes to measure.
What are the important patient outcomes to measure? That's what I've got coming up here at the moment. So what are the important patient, and it's tied on mine, but I know that'll possibly change with time. So what are the impact of integrated models of care? So we'll see how voting goes on that and what the final outcome, but that's a very close tie. So if we could just move to the next slide. Oh, sorry, it has changed. So what are the important patient outcome measures that's in the lead at the moment?
I'll just jump to question 7, Jenny.
Okay, so if we move to question 7, so if we were thinking about, say, potential systematic literature reviews or potential internships for the future, and we wanted to focus on a question, these are these need refining at the moment, but if you could help us to focus on which you feel are most important, then that would help us to be guided by what your priorities are. So what is the evidence of effectiveness for the advice and guidance model in England on referral rates and use of specialist services? Do you think we should conduct a literature review on that kind of question? Are advanced care plans effective for improving continuity of care in patients with long-term multimorbid conditions? Or is the advanced nurse practitioner role in the community effective at improving continuity of care for older deprived populations with cardiovascular disease or respiratory conditions? Or would you choose something different? Are we off the mark? Do we need to go back to the drawing board and have another think about some of these questions? So if you could vote on what you think is the most important question there, that would help. I'm just voting now. Oh, I think I voted on the wrong one. I think we were asked to vote on the first one and the second one. I don't know. Oh, I think another one's popped up. Hang on.
Yeah. So advanced care plans are winning at the moment. But what is the impact of
advanced care plans are winning? Okay. Yes, they certainly are. 62%. Great. Okay. Yeah. So if we just move to the next slide, because I'm aware that we are probably running out of time. And we've got question 8. So we'd like you to vote for a possible potential internal pump priming project. These have been inspired by some of the conversations that we've had in our workshops. So do you think moving forwards that we should try to focus on survey of patients to identify problems in the care pathway and potential interventions, or look at the use and impact of advice and guidance in primary care and secondary care, possibly with help from primary care networks? Or do you think we should focus on something else moving forward? And if we could vote on that.
Jenny, just to let you know, we finish at 11:30 and not 11:15. That's been changed now.
Okay, that's really helpful. Thanks. Okay.
Okay. So it looks like advice and guidance is winning, but there's still a lot of interest in. Oh, surveys just jumped way ahead. Okay, yeah, there we go.
Surveys jumped way ahead. This is very interesting.
Yeah. Okay, so that's
great.
It's really helpful. Okay, so the pressure's off because we've got a few more minutes.
We've got a bit of time. Don't have to rush.
Yeah. Okay. Fine. So the third area of interest was around multimorbidity and polypharmacy, and the kind of these 4 areas were highlighted, and again, be good to get a steer from you as to which you think is the most important. I mean, firstly, it's kind of general lack of understanding around the organisation of care for people with multimorbidity, and obviously that's got some quite a lot of resonance with the continuity of care stuff that we were talking about just a few minutes ago. Questions about what are the effective models, what are the tools and interventions to and particularly reduce the medication burden for people, and make sure that there is kind of a cohesion in the approach to prescribing and use of medicines. So I appreciate there's a fair amount of overlap in these questions, but it'd be good to just get a steer from you as to whether you think they're important from voting. so at the moment, 3/4 of people think we should be focusing on trying to address this problem. There's kind of lack of understanding around the organisation of healthcare for people with multimorbidity, and I think that really has quite obviously quite a lot of resonance with what's been prioritised around the continuity of care. So it's just changed a little, so there are more votes now for again effective model. And I think there's obviously quite a lot of overlap in the first two questions, and less priority around deprescribing, which I guess is a very focused intervention around some of the multimorbidity problems. Okay.
Being extended to 11:30.
Okay. So, right. So we gave some thought to some pump priming projects that might be done within the theme. So it'd be good to again get your view about this. Should we be conducting a mapping exercise with members to try and understand what the multimorbidity pathways look like? And obviously a survey is also being put together to try and glean what multimorbidity research is being done on the Northwest Coast. Should we be working with partners to support evaluations of existing models of care that have been implemented? Should we undertake a project around the implementation of deprescribing, or do you think we're barking up the wrong tree, and do you think we should be rethinking which would be the other option? Needing some joinery in the background. Okay, so where are we?
I think if people aren't talking, they could possibly go on mute, if that's okay.
Scratching out on the table.
Just sound like somebody's soaring. So, have you got control of the mute button, James?
Yes, I'm just searching. I think it might be Ruth. I'm gonna try mute, and I think it may be gone now. Yeah, there you go. Sorry.
Okay, so there's interest in working with partners to support evaluations of care packages that are already in place, as well as enthusiasm for conducting a mapping exercise around current multimorbidity pathways. And again, there's potentially quite a bit of overlap in those two ideas. So I shall toggle. Okay, right. So I guess we rushed a little because we thought we got a little bit muddled over timings. I'm sorry about that, but so we have actually got a few minutes left to provide a bit of an overview. I haven't got access to the graphs. I guess it'd be helpful to look in the chat and see whether there are any specific comments people have got. I think
unfortunately the session has ended for some people from the comments. I can see that it was meant to end at 1/4 and it has ended at 1/4 for some people, unfortunately. But I think we could still possibly do a word cloud to ask people to sum up their view.
Right. Yes. So so clearly it hasn't gone completely to plan, but we have managed to kind of get some sense check of some of the ideas, and it will be helpful to hopefully get some further feedback to help generate some word clouds. I'm back in. Okay. So I'm just looking at the comments there. I think people are some people are coming back into the meeting. So yeah. So I guess it'd be good to. It'd be helpful if you could put comments in the chat as to whether you found this kind of approach using the voting and an attempt at word clouds was helpful. Whether you think we're going in the right direction in terms of using this digital technology, and whether we should pursue refining this. And as Pallavi says, have you got any questions that you want to put in the chat that we can try and answer in the closing minutes? Okay, so I'm looking in the wrong place because most of the comments are actually coming in the Zoom chat rather than the app chat, aren't they?
Yes.
Okay,
So
it's
people,
really strange.
people quite like the polls. Yeah.
Yeah. It's really strange setting your own study, not being able to see anybody, isn't it? It's really strange. Okay, so what's coming in? I managed to get there. Yes.
So yeah, I think we're all trying to get used to this new technology as well. So I think people didn't get to vote necessarily on everything that they might have wanted to this time around.
Yeah.
But you can always post something in the comments and we'll take that on board. Yeah.
Just like to say as well, for anyone that if you join this session via Zoom over the break that's coming up, if you come back to the 10:40 to 11:30 session, the one we're in now, and click on the polling tab, you'll still be able to vote in all of the polls.
Oh, that's great. That's great.
Yeah, and Karen highlights that it would be nice to chat rather than just vote. And I think what we've really struggled with is how do you create that chat in a large online meeting. Our approach to that previously had been to have breakout rooms with a number of small discussions, and I think we'd be good to, if anybody's still around, whether you think that would be a good idea to pursue next time. We're conscious that the time allocated to the meeting was again quite short, which means it's difficult to have breakout and then come back. But if people think having breakout rooms would be a good way moving forward, do please drop that in the chat, and we'll do our best to incorporate that. Yeah, Caroline thinks that's probably. If anybody's got any better ideas for having how we engender a discussion in a large online group, that would be great to hear as well. No worries, Ruth. It was soaring after all. Yeah, so people like the idea of breakouts. Yeah.
And I think our intention this time was to build on the workshops that involved breakouts in September and February. And we kind of wanted to be able to create a consensus and also feedback on some of those conversations really this time around. But certainly for the future, we can look at more breakouts.
Yeah. I mean, we had a problem last time that we couldn't have breakouts of breakouts in the way that Zoom was set up. But I think we can take this forward to the management group, because I mean, when we have our kind of person-centered complex care meetings that are outside the ARCFEST, and we've got control, and you know, it's reasonable for us to have a longer meeting, isn't it? But there are always much more significant time constraints within the context of an ARCFEST, where there's many competing meetings to put together. Okay, any other comments come in? Yeah, I agree that using the chat is helpful. It is difficult to keep your eye on the chat, a PowerPoint presentation, and everything else. So I think we need probably need to divide or identify, have someone in charge of managing the chat and moderating the session, probably, because it is challenging to multitask, certainly for a male anyway. Okay, so there's lots of positive comments and ideas come into the chat. James, can we save the chat so that we can look at that in the cool light of day, from both the Zoom and from the app?
Just a reflection on what you're saying to anybody that's going to the break next. If you want to continue the discussion from this session, you can continue to use the chat, and as I said, vote on the polls even when the session's not live. So just navigate back to it in your schedule. All of those comments and the entirety of this chat will be sent back to the PCC team as well, so they'll be able to read all your comments and questions after today's event.
Yeah. Okay. Just picking up the comments from Neffin and Jen Logue. I think the option of people voting before the meeting and then re-voting when is potentially good. It just involves more preparation, and I'm sure we will get there. I think the risk is we'll be just about on top of digital communication by the time we're all wanting to meet in person. But we need to. I mean, what's very clear is that digital communication does allow greater inclusivity, and we need to make sure that we learn the lessons and keep using it. Okay, I think I will call this meeting to an end. Thank you very much for your participation. Give us all a comfort break and an opportunity to put the kettle on before the next session starts. Okay, so yeah, thanks for joining us.
Yeah, thanks everybody.
Thank you, everyone.